Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. We're here today talking all about our upcoming conference. That's right, we're talking about our tongue-tied conference here at Gold. We're very excited this year because we've graduated in from a symposium to a larger event, our conference. And we're very excited to say that we have an opening and closing keynote that you'll all be able to attend for free. And of course, we've got some incredible speakers, including Annette Leary. Welcome back, Annette. It's so good to have you here today.
Thank you. My pleasure as always. It's always great speaking for Gold. It's a wonderful experience. Thank you.
Well, speaking of experience, Annette, you are one of my friends and colleagues that I just feel is so balanced in your work, but you have worked very hard to get there. And it is all about your experience today, I feel, because not only are you an IBCLC, a registered nurse, and of course, one of the topics that you're going to be talking about, craniosacral, you are craniosacral therapy as well. And so the topic that we have you sharing on is craniosacral therapy, a complementary tool to relieve tension in the tongue-tied baby. I know that this is something that is so near and dear to your heart because, you know, you've been working in that particular area for an extended period of time now. But maybe just tell me, how did you get into craniosacral therapy? And then we can talk about really how it does complement the work that you do as an IBCLC as well.
All right. Yeah, it's funny that you asked. A lot of my clients will ask me that all the time. How did you decide to do this? This is just so different because coming from a medical field of being a registered nurse, craniosacral therapy is osteopathic in nature. A lot of doctors of osteopathy are trained in craniosacral maneuvers. So I'm not a doctor, I'm a registered nurse. And for me, when I first started doing this, I had this crossroads. My children were grown. I'm like, what do you want to do when you grow up? You raised your children. What do we do next? And I didn't want to, I thought about becoming a nurse practitioner. And I said, wait, I need something that's a little bit more holistic, a little bit something that I'm not going to be told, no, you can't say this or you can't do that, that I'm just going to follow what the families need. And it turned out that in our community here, their parents were waiting 6 to 8 weeks to meet with a craniosacral therapist. I
Right.
first learned about it when I lived in Boston. I would watch the doctors go around that were osteopaths and and they would do something to the babies as they were assessing them in the hospital, and all of a sudden they were eating and feeding better. And then I would often recommend it to other families for babies that weren't sleeping well, that weren't sucking well. So when I moved to Florida and learned about it, and as I said, my families were waiting so long, I'm like, can I just learn one or two things that I can do to help these babies, to help these parents feel more relaxed or more confident in their parenting? And I'm lucky that the Upledger Institute is here in Florida and they offer courses quite often. And true story, I went and took just an intro course. Just show me what this is about, because my mind is medically minded. Like, okay, I can't do harm, right? And I want to make sure I can't harm anyone, or what I do or how I touch someone isn't going to be bad. So what I did was I took this intro course. They taught you the first 6 steps, and I treated my husband, my son, my daughter, and then they were having the next course, because there's several courses I had to take before I could ever work with children or work with families or children under the age of 8. They really don't recommend you do that until you take these 3 adult courses. And I was getting ready to take the first adult course, and my daughter texted me and said, Mom, I don't know what you did to me 6 weeks ago, but can you do it again? My anxiety went away. I was sleeping better, and it's starting to creep back. If that was the affirmation that I needed, it was amazing that day. And from
That is
there,
amazing.
my world just blossomed, that the courses just kept coming close enough to home that it wasn't, I mean, it's expensive to take the 4-day courses, I'm not going to lie, but I was also in a good position where I had lots of friends that trusted me. And when I said, can I practice on you? I need to get 75 of these first steps before I can take the second course. They were
Right.
lining up, calling me and giving me what I needed was positive affirmations of, yeah, I didn't realize I was walking better. I didn't realize I was standing taller until people pointed it out to me. This is what the clients are saying to me. And I'm like, okay, Annette, you're on the right path. Let's just keep going with this and see where this takes you.
I love that. And as you're talking there, I'm thinking about, how I've learned more about craniosacral therapy. I'm not a therapist at all, but I have some beautiful people in my life that do it, what that I can recommend my clients to. But it seems like, craniosacral therapy, once sort of a bit mythical, it really has come full circle for so many people. And I think for our families, when I talk about it now, they're a lot more open to it. They understand that it's a holistic, gentle way of treatment. Often I asked you earlier today, do you treat the mother and the baby? So
Yeah.
many of the cranial sacral therapists do together. It's sort of a dyad, and that treatment is beautiful. And I just feel like when you have something that is, we're talking about tongue tie, which is not only restrictive in the physical form, but there are a lot of barriers, I think, that are impacting families that are mental barriers. There's psychological things happening too
Yeah.
that are impacting the stress on the body. So we know that the body is impacted in that way too, right, Annette?
Yes, absolutely. And it's one of my favorite things. But again, when I'm working, I have to trust that the body will I'm self-facilitating the healing and wherever it needs to be done, whether it's the
Right.
parent from the birth. But the most amazing thing is, because you're right, a lot of people are like, oh, is this hokey? I don't know about this. They come back. They come back over and
Right.
over again. And sometimes she said, I'm here because my mother told me to bring the baby back to you. That
Oh,
whatever that
wow.
lady did made a difference, and the baby was calmer and sleeping better and eating better. So whatever button you pushed, whatever,
Yeah.
can you show us that magic button? So yeah, it is amazing to me, because even as a practitioner, I am often amazed at what I see, and it's even often palpable in the room. Like I've
Oh,
been into labor rooms and helping with inductions or calming down
wow.
the uterine contractions. And one time a labor nurse walked in and said, "Whoa, what's going on in this room?" I was working on a mom and
Yeah.
showing the partner what to do for her in labor,
Mm.
where to place their hands. And the nurse walked in like, whoa, I'm usually really chipper. What is going on? What kind of medicine is in this room? She said, as everyone was just chill and calm. And the
Yeah.
and, and the mother, the birthing parent, had calmed down and was feeling really kind of at ease at that time. Another one
Right.
had worked on her during pregnancy, was trying to get her labor to start, and I was able to palpate the hormones of oxytocin through her pituitary.
Mm.
She's like, "What are you doing? Because you never hurt me. What are you doing? My uterus is contracting."
Wow, that's pretty incredible. I think that what I've learned from you too over the last, several years, but I feel like I'm learning all the time, is that it is a whole body experience when you have craniosacral therapy. But in the context of, I mean, that's really predominantly where I send clients in, is through when they is a tongue tie or some amount of restriction, misalignment, as well, is really helpful. The acceptance I'm seeing is really important, in the community, in terms of understanding the modality. But I think as a lactation consultant, Annette, I'm still wanting to know more to make sure that I'm following up well, that I'm asking the right questions, or I'm even presenting the modality to my clients
Right.
in a way that they understand it. And I think that you're going to be talking about some of those things during your presentation so that I can really have good communication through the parent, and then potentially even maybe even calling the local craniosacral person and asking some questions too, right?
Exactly. As I said, my training is through the Upledger Institute. So
Mm-hmm.
there is a website that if I'm doing a virtual, or I have someone that's sent to me virtually and they're going back to their state, I can usually say, hey, let's look here. Let me find you a therapist. You're moving to California. Let me look on here. I can tell you what classes they've taken
Oh,
and how
that's
well
awesome.
trained they are.
Yeah.
In my community here, I get a lot of referrals.
Mm-hmm.
If you could if you can experience the therapy, that would be something, one place to start, so that you know what you're feeling and say, wow, You barely touched me. You had 5 grams of touch on me. That's less than the weight of a nickel. Okay. A
Wow.
nickel weighs 5 grams, and that's the
Yeah.
touch I do. And that's why I work with the parents too. A lot of times it's really helpful for some of their anxiety and their PMADs and other things. They'll come back and say, "Can I have a session with you?" And I'll lay the baby, and we'll just see the different changes. I've even seen changes as the baby's tissue releases. You'll see red marks on their tissue, not bad red marks, but then the mother has red marks in that same area. It's bizarre, that mother-child connection. But yeah, if you can experience it, if you can call your local craniosacral therapist and just say, "Can you tell me a little bit more about this?" Going to the Upledger Institute website, really, they have a lot of beautiful education explaining exactly what it is, how to find a good therapist, what you're looking for.
Yeah, absolutely. And I think that's the key that we're all learning, is that this is just, it's so beneficial towards the element of healing, and complementary to breastfeeding. So I honestly, I can't wait to hear more. I think by far this presentation that you have this year at goldtonguetie.com is by far one of the best I've ever seen from you, Annette.
Oh,
So
thank
I'm
you.
really excited. I'm excited for you to be here, and I'm keen to learn more. I want to communicate better with my clients on this topic and learn about those different aspects of really, what's happening. And I know you've got some case studies for as well. So thank you
Yeah,
so much again
my
for being
pleasure.
open and being here with me here today. Always learning new things. Again, Annette Leary is going to be here at our Gold Tongue Tie conference. You can find all the details on our website at goldtonguetie.com, where you can register for this event. Early bird registration is in effect, but also we have some open keynotes for you as well, which is really exciting. And I can't wait to see you all there. Thank you again to Annette for being with me here today. And to all of you listening in, thank you for joining me. We'll see you all very soon. Bye-bye for now, everyone.